last year's hard-earned wages that instead of going to our families, went to save our hospital. But in red, you see what we think happened to that money. Jackson was not sustained. Nearly 0 initiatives were implemented, in our opinion, and that money was down the drain. For that, we regret doing business with management in such a way that we trusted that our hard-earned dollars could be donated to you, and you would do your job well and sustain Jackson. We're disappointed, obviously. Over a year later, we're in the same boat. You're coming to us out of no market pressures, no salary analyses, but pure desperation to save Jackson. The quickest, fastest Band-Aid is to take once again from your employees. And for that, we regret that you're in charge, to be blunt. You know, if we're going to give the money, you might as well let us run the hospital if this is the kind of behavior we're going to see, is wasted $106 million. This year again, we're back at the trough. The employees are asked to give, this time the number, $122 million. It's up. Yes, politically, times have changed. Medicaid dollars are trimmed for the public hospitals. Baptist is getting more. You know, politically, Jackson is a threat. We understand that. We're willing to be the foot soldiers to fight this fight. But once again, we regret having to give our hard-earned money that would benefit our children, our families, and ourselves. And instead, we're forced with having to give money over to management with our fingers crossed that Jackson will be sustained and turned around. You know, we hired experts on top of the $106 million. I think Dwayne Fitch is still in the room. Experts who turned around Cook County were paid for with additional monies to the $106 million to help save Jackson. A white paper was written by Fitch Healthcare for the roadmap for victory. Mr. McGoy agreed with all those concepts. He used that document to convince others that he was the one to be hired here. And thank God he read the document, thank God he agreed, thank God people believe the white paper is accurate, strategic plan for sustainability. We still don't have a strategic plan at Jackson. I think it's coming up some weekend in the near future. Still do not have a strategic plan. Again, the caregivers are asked to give. So while we are partners in this because we believe in this public hospital, and for 92 years it's been serving the right mission, I've been very proud over the years to tell elected officials this is the way healthcare should be delivered. At Jackson, a not-for-profit public hospital, we want Jackson to be sustained for the sake of this community, for our patients. We do not want Jackson to be privatized. We do not want it to be a private not-for-profit. We do not want the keys handed over to some private entity who can decide what gets turned on and off as far as services in Dade County to our most needy and all of our community. So here we are again with management trying to fill a gap. Again, asking $122 million from your employees, and that's all of labor. We have proposals for you today. We'll go over those in a minute. You'll see that we will make a loan to you one more time, but this time with strings attached. This time, as you see the checks are written out, the patients must benefit. No longer can it be flushed down the toilet. No longer can it be wasted away with incompetent managers. It must be used wisely, and we must have language that protects the donation that your employees are making. There is no rush. There is no other hospital in Dade County that's taking money from their employees right now. Most of them are giving raises. Most of them are giving sign-on bonuses to ex-Jackson employees, as a matter of fact. We are hemorrhaging nurses and other caregivers who are leaving because of these pressures. that after 3 years of in a trench, we're being told now the trench is at least another 3 years. This is not tolerable. We have got to turn Jackson around once and for all and sustain it. We have never not been partners at the table to do just that. What we resent is the lack of ability to actually implement the strategies that we all know need to happen. The primary care strategy, the decreasing the length of stay, the holding accountable our partners who are very valuable but need to be held accountable. We all know what the answers are. The implementation is what is missing. You on the other side of the table are in charge of implementation, and we need you to do your job. You are sacrificing along with us, we understand that, but we need you to please do your job this time. These caregivers are willing to consider, obviously, the donations we're willing to give, and we will go over the proposals and talk about the strings attached. So again, I thank all of you for finding time away from the bedside and the patients to come. This is important. It's important mostly to our community. It's obviously important to us here. The one thing that has not failed at Jackson over the decades is the quality of care that's delivered by these caregivers behind us. And for that, I thank all of you for the great care you deliver. And I hope that we can win this fight to sustain Jackson once and for all and make it the proud jewel that we're all proud of in this community and we all want to sustain, and that, you know, we're with you as partners to make this happen. Again, we ask of you to have competence at the top of your list.